Hey guys, it's Spencer again with Nexus, and I have Steven here with me as well as usual. Today we're bringing you another presentation. Today's is on mental health awareness. So we'll be talking about what mental health is. We'll be talking about some of the different signs and symptoms of different mental health disorders, and really just trying to erase the negative stigma that surrounds mental health as a whole. So we'll be bringing you a lot of different statistics and information. So kind of sit back, we're gonna get started.
Hey guys, it's Steven, and as Spencer said, we're jumping into this mental health thing and we're just going to dive right into it. It's very important for us that we understand a clear definition of what mental health is, and for us, we use that mental health refers to the maintenance of successful mental activity. This includes maintaining productive daily activities, maintaining fulfilling relationships with others. It also includes the abilities to adapt and change and cope with stress. One of the things that we know during this time through this COVID-19 thing is it could be a real challenge to understand and maintain a positive mental health in regards to what you're dealing with in your current situation. So we want you to know that we're here for you, and we're going to try and give you as much information as possible so you can have a positive mental health when it comes to what you're enduring right now.
I mentioned earlier that one thing we try to do is we're trying to erase the negative stigma that is attached to mental health and mental health illnesses. One way to do that is to raise as much awareness as possible. So 1 in 5 teens aged 12 to 17 have a diagnosable mental health disorder, but only about a third of them are receiving the help they need. This could be for multiple reasons. One being some people just don't like to be seen as somebody who needs help mentally. Some people just are afraid to kind of speak up about it, and others just may not know where to go to get that help. So it's important to raise awareness and let people know that there is help out there and that you can recover.
Anxiety is something that almost everybody deals with on a daily basis. We have normal levels of anxiety. For the athletes, it could be the butterflies before the game, or if you're going to do a drama, the moments before you step on stage. Those sort of elements of anxiety are very different than what we're talking about on the list here on the right-hand side. The different variations include the generalized anxiety disorder, which just means there's just this anxiety for the most basic of things, all the time anxiety, if you will. And that actually goes to about 3.1% of people have that. Then you have the one that's probably the largest amount, which is social anxiety. That's being in small groups, it's big groups. It could be, I know a lot of people that have a fear or an anxiety of public speaking, that might be included in there. A panic disorder, PTSD or post-traumatic stress disorder, it's 3.5%. And that one is something that we commonly only attribute to the military, those that have been in the military and been on the battlefields and things like that. But it's really important that we understand that anxiety is not limited just to the military, but to each of us. If we have experienced a traumatic event, it could cause PTSD for us. Agoraphobia, that's 0.9% of people that have been affected by it or will be affected by it. And that's kind of like the fear of going outside, the fear of the unknown out there and all of that. And so it's kind of an interesting one. And then you have obsessive compulsive disorder, OCD, and that affects about 1% of people. That is something where it is almost debilitating when things are not in order. Some people might be really, really organized and say, oh, I have OCD. And they may not. They just may be extremely organized. Obsessive compulsive disorder really only affects 1% of those people. And so it's really important that we understand that there's anxiety when it comes to the sporting events and the butterflies and things like that. And there's other events that are really, really serious, the different variations of that affect people in a lot of different ways. So it's really important that we understand that how we feel in certain situations may be completely different than how other people feel. So we don't want to make those assessment or the judgment about those. So we need to make sure that we're always treating people respectfully.
Okay, so here we're going to be talking about anxiety as it pertains to a disorder. Now, like Steven said, anxiety is one of those things that we feel on a daily basis, whether you're a young person or an adult, you're going to deal with anxiety no matter what. But here we talk about anxiety as a disorder. So anxiety disorders affect about 10% of teenagers in the United States. Again, only about 1 in 5 or 20% are getting the treatment. Symptoms can include anger, irritability, trouble sleeping, fatigue, headaches, stomach aches, increased heart rate, and trouble breathing. It is typically more common in females than it is in males. It also differs from normal anxiety in the following ways. It is more intense, it lasts longer, and it interferes with a person's work, activities, or relationships. Those relationships can be personal relationships like friendships or romantic relationships or working relationships as well.
Tests. Terrific. Twitter. Oh, it's also overwhelming and stressful. But who has time to relieve stress when it's constantly building and building? Well, we hope you do. Because studies have shown that too much stress leads to headaches, higher blood pressure, an upset stomach, memory loss, disrupted sleep, and increased risk for heart attacks. Stress does a number on your mind and body, draining your immune system and messing with your ability to concentrate. Having tense, sore muscles, shallow breath, increased heart rate, these are all signs that you might be too stressed out. Hey, we all know that you can't take fewer classes. You can't quit the track team or resign from student government. We get it. But here are a few tips that will help you feel calmer inside when your outside life gets too hectic. 1. Stay in and recuperate. When stressed, you might feel the need to tackle everything on your to-do list all at once. But that sets you up for burnout and failure. Instead, find a simple routine task to complete at home, like doing the dishes or vacuuming. Studies show that completing a repetitive task allows your brain to pare down and focus. The perfect cure for a worried, scattered mind. After you finish cleaning your house, clean yourself. Yes, we wrote that. Clean yourself because a warm bath or hot shower will boost your mood. Studies have shown that the sensation of warm water triggers responses in the body and brain similar to those triggered by emotional warmth. So, think of your next shower like a soothing liquid hug. I love you guys. If you find stress keeping you up all night, try progressive muscle relaxation just before bed. That is a fancy way to describe clenching up every muscle in your body for a few seconds, and then letting go. Lie on your back and start with your forehead, continuing through your tummy, down through your thighs, and finally your little toes. Repeat as needed until every muscle is completely relaxed. Then, sleep like a baby. 2. Get out for good vibes. Downward doggy paddle your way through stress. The spiritual mantras used in yoga and meditation help focus the mind and stave off feelings of anxiety. Yoga not for you? That's okay. Go outside for a good dose of natural light and a little jog. Exercise lessens anxiety and helps maintain feelings of calm, even in the face of distressing events. Hey, leave the headphones behind. All the distracting chatter from those texts and emails and tweets can wait. And hey, instead of texting, emailing, or tweeting your best friend, why don't you guys just meet up and get in a good laugh? Because laughter injects a surge of endorphins into the body, which creates feelings of happiness and euphoria, which is why you like them so much. 3. Here's the best one. Treat yourself to something yummy. Chocolate. All right, look, we're not condoning emotional eating because that's a whole other thing. But there are treats that you can keep handy that will improve your mood, like dark chocolate. Certain chemicals in chocolate help relax the blood vessels, which reduces blood pressure. You can also appeal to your sense of smell for relaxation. The aromas of spearmint and lavender have proven de-stressing effects. So go buy a lavender-scented candle or pick up some spearmint tea. Take a moment to yourself and breathe in the goodness. There you have it, Wellcasters, our quick tips for stress relief. You're going to have to anticipate that life will be filled with ups and downs. So when the challenges do come, you can take comfort now in knowing that there's a warm shower just on the other side of your bathroom, or a delicious piece of chocolate stashed in your bag. So yummy. Be sure to incorporate stress relief strategies into your daily routine. Make them as essential as breathing, in through your nose and out through your mouth. Well, that's all from me today, Wellcasters. Would you do me a kindness? Subscribe to our channel Sign up for our newsletter to receive sneak peeks and other awesome stuff. See you later!
So that animation video, we hope, gave you a bunch of good information. What's most important, though, is that you know what works for you. It really is, in this time, unknown. When it comes to being able to go outside and being with your friends, kind of like she mentioned in that video, right now, that's not really what they want you to do. So it's finding alternate ways to do that. It could be working out in your garage. It could be coloring. It could be doing yard work. It could be going on a walk with your dog. Whatever it might be, we want you to do what's best for you, because overall it's your mental health that we're talking about here. Whether it's anxiety or stress or depression, whatever it is, we want you to make sure that you're doing what's best for you. And also, one of the cool things that I really enjoy is that muscle relaxation. I do it the opposite. I start at my feet and work my way up, but it is amazing. And if you've had Spencer or I in class before, or the both of us together, the other one we talk about a lot is the breathing technique. Breathe in for 4 seconds, hold it for 4 seconds, and then exhale. There are a couple other things that we talk about on our YouTube channel. If you type in Nexus Youth and Family Services on YouTube, and you go to the playlist, and it's SNS and the AC for Stephen and Spencer in Amador County. So check that out. There's a couple other techniques that you might be able to use, and we hope that you really understand that when it comes to your mental health, how you're addressing that in healthy, positive ways is unique to you, and you have to do what's best for you at all times.
Now we're going to talk about depression, but first I want to talk a little bit about how some people might tell you that as teenagers you're too young to feel either anxiety or depression. That's not true at all. Actually, right now, it's a very tough time to be a teenager because there's so much pressure on you, whether it's socially, from society, in school, from your friends, or whatever it is. And those things can lead to anxiety and depression. So don't ever let anybody diminish your feelings or anything like that. If you're feeling depressed or anything, just remember, there isn't an age limit for it. You don't have to reach a certain age before depression can set in. So depression can set in at any time. Now, some things to know about depression. Depression is the most common mental health disorder amongst teens and adults. About 2.8 million teens ages 12 to 17 have had one major episode. That was a study done in 2014. And 10 to 15% of teens have symptoms of teen depression at any time during their life. 8.3% of teenagers suffer from depression for at least a year. That's compared to about 5.3% of the general population. So it is a little bit higher, more prevalent amongst the teens.
So depression versus depressive disorder. Depression, we can all experience depression for a couple of days or a week and a half. For it to be considered a depressive disorder, it must last for at least 2 weeks. And what's really important is that it affects a person's emotions, their thinking, their behavior, and their physical well-being. But that's not it. It also affects your ability to work, whether it's at a job, a part-time job that you might have on the weekends, or if it comes to your schoolwork. And I think, personally, the issue with having satisfying relationships is probably one of the hardest elements of the depressive disorder. Not just for the person that has the disorder, but also for those around, because your friends care about you and want you to be in a better position. So having those satisfying relationships not being there really can be detrimental to your mental health. But also it affects your ability to carry out normal everyday activities, whether that's waking up, getting in the shower, brushing your teeth, eating breakfast, getting ready for school, having the constant communication that you would normally have. All of these things are elements of depression, but like I said at the very beginning, the depressive disorder is if it lasts for 2 weeks and affects your emotions, thinking, behavior, and physical well-being, and your ability to work with others and the satisfying relationships and to carry out normal everyday activities. So if you think that you could be experiencing this depressive disorder, it's very important that you talk to somebody, that you reach out to somebody that you trust that can help you get some different help.
Hey, I'm Ellie, and this is Lynn.
Hey.
Last year, I was diagnosed with depression, Lynn was there to see the whole thing go down. You've probably heard the words depression before, but might not know exactly what depression means. Let's say you get some bad news. Hey.
Oh my god. I just saw your boyfriend holding hands with Jenny at the mall. He is so over you.
Things like breakups are painful and might make you feel sad, frustrated, angry, or heartbroken. But trust me, most teens go through that kind of stuff. Depression is something completely different. Check this out. Think of the thermostat in your house or apartment. When the temperature in your house gets too cold, the heat kicks in and brings the temperature back to just right. Your brain works a lot like the thermostat. Let me show you. Let's say this line is the just right mood. And these two dotted lines are the happy and sad range of emotions that you might feel whenever. Like the thermostat in your house, when your mood goes down, your brain makes changes to bring your mood back up. When your mood goes up, your brain makes changes to bring your mood back down to that just right level. When I was depressed, it was like the thermostat in my brain broke. My mood started going down, and I got totally stuck, like at the super low level. That's when depression came into my life. When I was depressed, there were some really obvious signs that something was wrong. My sleep changed. I wanted to sleep all the time. I had no energy. Even brushing my teeth felt overwhelming. That sounds stupid, but that's how I felt. I lost interest in all the things I used to like. It seemed like nothing made me happy or excited anymore.
Don't answer the phone. No one wants to talk to you. Look at yourself. Who'd want to be around you?
I had lots of sad thoughts and feelings. It was like my brain kept saying things to me that I would never have thought before.
Ellie, I care about you. Things are gonna get better. I promise. You're just having a hard time right now.
Am I always going to be like this? I just feel so sad.
You're my best friend, and I know you're gonna get through this. I think you should talk to someone and try to get some help.
Just leave me alone. I felt like I was on an elevator going down, and I couldn't get off. I started to think that I'd be better to die than to keep feeling so sad. That scared me. I remembered what my friend Lynn said, and I decided to get help. I went to see a therapist. The therapist told me that the thoughts of sadness and hopelessness and suicide were my depression talking. My therapist said that as my mood went back up, depression would be forced to leave me alone. The other thing was to take the meds my doctor prescribed me to help my brain work the way it did before I was depressed. Having Lynn's support made a huge difference. After taking the meds for a while and talking to my therapist, I really started to feel better. Life is worth living again.
I'm just happy you're back to your old self. I told you you'd feel better.
All right, we've got some serious texting to do. So, TTYL. Depression is a serious illness, and it is so important to get help as soon as you start feeling depressed. If you are worried that you might be depressed, talk to your doctor and tell him or her how you're feeling. You can also check out this website to learn more about depression.
Okay, so in that video, there was a lot of good information about recognizing some of the signs and symptoms of somebody who may be feeling depressed or maybe fighting with depression. It's very important if you are having those feelings to go out and get the help that you may need. Find somebody you can talk to, whatever it may be, whatever you're comfortable with. It's also really important to remember that recovery is possible. They talked about that in the video, so it's really important to remember that and keep that in mind if you're going through that. Okay, so now that we talked about anxiety and depression, we're going to move on and talk about some of the lesser known disorders that are out there. First, we're going to start off with Stephen on the next slide talking about psychosis, which is actually not a mental health disorder in and of itself, but it's a symptom of a mental health disorder. And then after that, we'll move on to a few different disorders.
What is psychosis? Psychosis is a general term used to describe a mental health problem in which a person has lost some contact with reality, resulting in severe disturbances in their thoughts, their emotions, and even their behavior. Psychosis is not a mental health disorder. It is a symptom of a mental health disorder. It's often thought, too, that a person with psychotic symptoms is very dangerous to other people, when in fact, people that are experiencing psychosis, they might behave strangely. They may hear voices or see things that don't exist. They may be frightened or confused or even withdrawn. However, it's more likely that they would actually harm themselves than somebody else. So yes, they could be dangerous, but they're more likely to hurt themselves than anybody else. So we have to remember that it's important to help anybody, especially someone with a psychotic symptom, to get treatment as quickly as possible.
Stephen mentioned on the last slide that psychosis isn't a mental health disorder in and of itself. However, it can be a symptom of multiple different mental health disorders. So over the next few slides, we're going to talk about some of the mental health disorders where psychosis can occur. We're going to focus on these three: schizophrenia, bipolar disorder, and drug-induced psychosis.
All right, so schizophrenia. Schizophrenia is something that we need to differentiate between those that have experienced multiple personality disorder. And so schizophrenia is somebody that would hear voices or hallucinations, where multiple personalities is exactly that, multiple personalities. And so schizophrenia affects 0.3 to 0.7% of Americans each year. And that number obviously continues to increase every single year of the number of Americans that are experiencing schizophrenia. 75% of those experienced their first episode between the ages of 16 and 30. And in one of our other slides, presentations, we've actually explained that the male and female brain doesn't finalize its development until the age of 23 to 25, 26 years old. So it's still kind of in that range. Rarely does schizophrenia develop after the age of 45, and symptoms could include delusions, hallucinations, thinking difficulty, loss of drive with kind of what they're trying to do, the ambition of their lives, blunted emotion, and social withdrawal. And so actually what we're going to do is this next thing that you're going to see is a schizophrenia simulator. Be cautious for it. Hopefully it doesn't trigger anything for you. And we want to let you know it's about 5 minutes long. And be cautious of the things that are said and the things that he hears and the feelings that kind of arise from that during this time.
Worthless.
He's waking up now.
Oh, the phone woke him up. Don't answer. They'll know who you are.
You're a waste of space.
Why are you so stupid?
A waste of our time.
Stupid. So stupid. Worthless. We hate you.
He's gonna pick up the phone.
They'll know if you lie.
Rain! It's
Something
rain!
wrong. Weather.
Now to get pizza.
Poison.
Mommy, pizza.
He's hanging up.
Can you hear me?
Don't eat. Out to get you.
Poison.
They know about poison.
The suspect was described as medium in stature, slightly short. Anyone with information about this incident is heard.
They know. They know about you.
And another news,
Time for meds. Don't do that.
Now here's a story out of Chicago from last night. Two men posing as maintenance workers nearly made it out of the Quick Bite convenience store before his ATM machine.
Make a list. Make a longer list.
Entered the store, asked the
You
customer
are
not to use the
ungrateful.
machine because
You're a
it was
waste of
problem.
space.
They
A
told
waste
the
of our
clerk that they were
time.
going to take the machine back to the
Getting
shop.
coffee now.
Don't drink it.
Sensing something
Stupid.
suspicious,
So
the clerk
stupid.
That smells awful. Don't drink that coffee.
Both men had called police to prepare to investigate.
Why are you so worthless.
So Sky, tell us how this weekend's weather is shaping
Weather.
out.
Something wrong.
You know what, Chuck? There's just no stopping the weekend weather. You hear that, worthless? Weather's coming to get you.
Something wrong. Weather.
And what are you going to do about it, huh?
Something wrong. You have to stop it.
You're just going to sit around, your stupid mouth open and do nothing?
You have to stop it. It's the weather. It's here for us.
Now he has to answer the door.
It's here for us. Do something. Stay in.
Pizza.
Stay away from the door.
Stop the weather. Protect us.
Pizza.
You didn't order anything. No, don't answer. You're stupid to open that door. He has to open the door now.
Here you go.
Don't do it.
You'll be in trouble. Poison.
This is for you.
This is for you. He's working with them. He's part of the plot. This is for you. Shut the door. Shut it. Don't eat it. Poison. You're stupid to open it. I hate you. We
Here are
hate
some
you.
items on today's activities calendar.
And you need some activities, especially when you're lazy and you sleep too much. Stop staring at me.
I know what you're thinking.
He knows. You can't stop
They're
it.
coming for you. You know that.
Part of the plot. Use your mind.
It's because you're so ungrateful.
Don't eat it. Poison.
No. Don't open
He
it.
has to open the box.
This is entirely your fault.
Don't eat it. Don't eat it. Poison. Poison.
They're here, and it's all your fault.
Oh.
No.
They know it's you. You're in
Don't
control.
open the door.
You hear that?
No. Don't open it. Don't open it.
They're here, and it's all your fault.
You did it.
You should have used your mind to stop it.
Stop it. You have to take control.
Stop the door.
Hey, you all right in here? I called you. Why didn't you answer? I was like screaming, "It's Lorraine! It's Lorraine!" into the phone at the top of my lungs.
What were you watching? Do you even remember?
Did the pizza Oh, what happened here? Did you forget to take your medicine this morning? Well, you know it's not good to miss a dose. Well, it's not too late to take it now. Let's get back on track. And why are you standing here in the dark? It's a beautiful day outside. Let some sunlight in. You need to get outside and enjoy it.
That video was a small glimpse into the day in the life of somebody who has schizophrenia and what they could be dealing with. Now, that person in that video had what would be considered probably a severe case of schizophrenia because they had both auditory and visual hallucinations, which means they were seeing and hearing things that weren't there. So typically with schizophrenia, there will be varying degrees of it. So each person's going to experience it differently, but that gives you a small understanding of how difficult it could be for those people to go about their daily lives when they're hearing voices like that. So it's really important that if you know somebody who has a disease or you feel like you may have it, just being very understanding of that person and not being judgmental.
All right, so we're going to talk for just a minute about bipolar disorder. Bipolar is also, you might hear somebody refer to it as manic depressive. And one thing that's really kind of, I think, dangerous when it comes to bipolar disorder is that when somebody is in the manic phase, they are on top of the mountain. They have the most confidence in the world. It could be with gambling or personal relationships or whatever. They just feel like they are on top of the world. And then there's like this sudden extreme depression, this deep, dark depression. And it's quite literally day and night. And one is really extreme on the happy or good side, and then the other is the not so good side. And so it is common for people with bipolar to experience extreme mood swings. That's that high and low as I'm talking about. Also, bipolar affects 2.6 of Americans every year. Symptoms could include depression. Depression symptoms followed by a manic phase, which is like the depression is down and then the manic would be up, which may include increased energy, elevated mood, needing sleep, irritability, rapid speech, inflated self-esteem, and the feelings of superhuman or talented. And it's also really important, you guys, that you understand that if you're interacting with somebody and their mood changes all of a sudden, it's a common phrase like, oh, that person's bipolar. That's not entirely true. And so these people might experience or might have bipolar disorder, and they have their own things that they're working through. So if someone has a sudden shift in their demeanor, it doesn't mean they're bipolar. It means that something might have triggered them and upset them drastically. So we have to be very, very cautious of how we use those terms. And we have to understand that bipolar disorder is something very real that affects quite a few people in our country.
The next instance we'll talk about where psychosis can occur would be drug-induced psychosis. This is what happens when somebody uses a drug, whether it's legal or illegal, and they go into a psychotic episode. So symptoms appear quickly and usually last until the drugs wear off. Both legal and illegal drugs can contribute to a psychotic episode. And the most common symptoms include visual hallucinations, disorientation, and memory problems.
All right, so next we're going to talk about the substance use disorder. And basically, that's a term for drug addiction or substance addiction. It's a disease that affects a person's brain and their behavior, and it controls or is the inability to control the use of legal or illegal drugs. And that could include the abuse of alcohol or drugs and the dependence of alcohol and drugs for those things, whether they are legal or illegal. It is estimated that 21.5 million people ages 12 and older have a substance use disorder, at least in the last year or so.
What some people may not realize is that eating disorders can also be considered a mental health disorder, so it's important to understand these as well. So over the next few slides, we're going to talk about 3 different eating disorders. They are anorexia, bulimia, and binge eating disorder.
All right, so now we're going to talk about anorexia. And anorexia is an emotional disorder that's characterized by an obsessive desire to lose weight by refusing to eat. And so one way that people can do that is through fasting or over-exercising, maybe using laxatives, diuretics, diet pills, and even possibly vomiting. And one thing that we know is that it's an extreme focus on the body shape or weight to determine one's self-worth. And 0.6% of Americans experience anorexia in their lifetime. So given the total number of people in our country, that number can actually be pretty high. So it usually starts in the adolescence from over-dieting because of their weight image or their body shape and trying to determine their self-worth. And it is more common in females than it is in males. But it should be noted that males also do experience anorexia. It's just not as common in males.
All right, next we'll talk about bulimia. Bulimia is defined as eating unusually large amounts of food followed by excessive exercise, fasting, or purging. Purging would be making yourself vomit after eating. Like anorexia, bulimia has a focus on body weight or shape to determine a person's self-worth. Again, bulimia is actually more common than anorexia. About 1% of our population experiences bulimia. It is less noticeable than anorexia because a person can be seen eating, whereas an anorexia person will typically refuse to eat. With bulimia, that person will eat and may even eat excessively, so it doesn't seem like they're going to actually lose weight. But what people don't see is the purging after they're done with the meal.
Binge eating disorder. This is where eating unusually large amounts of food in a very short period of time becomes too much. It's beyond the point of feeling comfortable of how full your stomach is. And so in order for it to become a disorder, the binges must occur at least twice a week over a 6-month period or more. And that is when a person has lost the sense of control while eating.
Okay, next we want to talk about non-suicidal self-injury. Now, there's a common negative stigma attached with this that people who engage in something like this are just kind of looking for attention. Now, that may be true, but not in the way that you think. They could be looking for attention. They could be kind of reaching out for help because they don't know how to actually verbally ask for help, or they don't know where to go for help. So they do these things to kind of show that, hey, I'm not in a good place and maybe I need somebody to talk to. So 15.3% of college students stated that they had engaged in non-suicidal self-injury at some point in their life. There are different types, which include cutting, scratching, pinching of skin, enough to cause bleeding or a mark that stays on the skin. Also banging or punching objects to the point of bleeding or bruising, carving patterns in the skin with knives or any other kind of sharp object, interfering with the healing of wounds. So it could be like picking scabs and not letting something heal properly. Burning skin with cigarettes, matches, or anything else is that extremely hot. Also pulling out large amounts of hair. Like I said, these people may be actually reaching out for help, and it's very important for us, if we see somebody like that, to ask them, hey, are you okay? Do you need anything? Can I help you get the help that you need?
All of that to say, taking care of your mental health is one of the biggest things that you can do. Yes, your physical health is extremely important, but your mental health can take a big toll on you, especially with times that we're experiencing right now like we've never experienced before as a country. Whether it be not being with your friends or your significant others or being at school, all of those things can really take a toll on someone's mental health, and we're aware of that. And what we want you to do is we want you to identify ways that you can do that. Identify and recognize your personal signs and symptoms. Nobody knows you quite like you, and we would hope that you would talk to someone that's close to you. It could be a friend, it could be a significant other, it could be whoever. We would just hope that you would talk to them and get help when needed. If you don't know who to talk to, there's always our information on the first slide that you can go and get our information, and we would love to talk to you and go through this with you. Another one would be exercise. Exercise releases this chemical of dopamine that goes to your brain that makes you feel good when you exercise. Sometimes in the moment it's torturous, but it feels great when you're done. Also, staying away from drugs and alcohol. Those things can become depressants and really mess with your mental health. Unplug. What that means is turn your AirPods off, turn your phone off, turn the social media off, unplug from that. Maybe go for a walk, maybe read a book, whatever it might be. Just unplug from all the negative things in your life and focus on you by trusting someone and telling someone as well. Also, we would encourage you to eat well. A good diet is important for your body. We also would like you to, or if you can, to get enough sleep. It really is beneficial for taking care of your mental health. Listening to music. I don't know what music you like, but I'm sure if you know what music lifts your spirits, you should try and listen to some of that. Right now, this one might be difficult, but when we get back to normal in society, hanging out with supportive people and having those healthy friendships, being face-to-face is really important, and we hope you would have those. And if you do have those people that you would typically hang out with and you have those healthy relationships with, we would encourage you to use Zoom or FaceTime or be in constant communication with them. And lastly, check in with a school counselor or trusted adult. Like I said, Spencer and I will have our information on the front of this. So if you want to contact us at our office or you want to check out our social media page, we would love to talk with you and kind of help you walk through whatever it is you're going through in the meantime.
Like I stated earlier, one of the things we're trying to accomplish is to help in the negative stigma that surrounds mental health illnesses. We want people, especially young people, to start to feel more comfortable talking about their mental health status. So if you're experiencing any of the signs and symptoms that we showed today in the presentation, please feel free to come forward. Come to us if you need to. Like Stephen said, our contact info will be on the first slide of this presentation. So please go back, contact us if you need us. We're always here to help. We're more than willing to help. We don't clock out at the end of the day, so if you need to get a hold of us, please do. We're here to help you guys in any way possible. As always, stay healthy and stay safe.